So we've had a very successful year this year in terms of banning the tan under the age of 18. 2 years ago, Vermont and California were the first states to ban under 18. This year, we expect there to be 4 additional states to ban under 18. Oregon, Nevada, and Texas have already passed legislation, and Illinois, we think, and we're very hopeful, will pass an under 18 ban very shortly. There's also been movement in other states. The state of New Jersey passed a ban under the age of 17. There have been some more parental consent bills this year. And even in states where there hasn't been legislation passed this year, there's been a lot of movement on those bills and a lot of inroads made. We're living in very exciting times now because 2 years since the FDA device panel heard expert testimony from dermatologists and patient advocacy groups on the consideration of reclassifying tanning beds to a higher level. The FDA 2 years later has come out with a proposal to increase the classification. Currently, tanning beds are at a very low level. They're at class 1, which is like tongue depressors and Band-Aids, and the FDA proposes that they be raised to class 2, which will provide the opportunity for a lot more administrative oversight, improved warning signs, and more stringent performance standards. We're hoping that the ruling will be that they stick by their proposal, that the beds will be classified at a class 2 level or higher, but we think class 2, and that they'll stand by their recommendations, which are that tanning beds shouldn't be used by under the age of 18, that there's risk for tanning beds, they shouldn't be used in somebody who has a history or a family history of skin cancer, and we're hoping that the label on the beds themselves will be very clear and transparent to the public that those beds are dangerous. Well, there's always an opposition. There's the other side. There's the Indoor Tanning Association, and they argue in favor of no regulations, and they use all sorts of arguments and sort of distort the truth. So we have that hurdle to overcome. We also have the hurdle to overcome of the political process. So there's so many competing interests in the legislatures, and there's varying opinions on whether it's the role of government to regulate indoor tanning. So we have all sorts of hurdles to overcome, and every state has a unique situation. I think that the dermatologists, it's really our role to take the lead on this subject. And we have a lot of opportunities that are right before us. So we can talk to our patients about this. The nice thing about state politics is that state legislators are much more receptive to meeting with you in person, so a lot of them might be your patients. So this is something that dermatologists can get involved in very easily with a phone call or a visit to their legislative office. I think it helps to work through organized medicine in terms of orchestrating an entire advocacy plan. So I would encourage them to get involved with their state derm society. I would encourage them to get involved with their state medical society because they oftentimes drive the political process in those states.